Hi friends, are you an orthopedic or neurosurgeon currently struggling with your open spine surgery, currently struggling with some complications of open spine surgery? Are you an endospine enthusiast who is willing to get into endospine surgery but there are so many unanswered questions in your mind? I understand you must be having many questions like, will this endoscopic spine surgery be the answer for many of my pathologies which I am dealing in my day-to-day practice? If I get into endoscopic spine surgery, should I get into UB? Should I get into MIS tubular system, or should I get into full endoscopic surgery system? If I buy full endoscopy, what will be the cost? Which instruments should I buy? If I buy the equipment, I get the exact knowledge. I need to understand which are my actual indications, what are my contraindications in my learning curve, how I'll pass my learning curve, and how I'll decide based on MRI that which approach will be good for me, whether transforaminal, whether interlaminar, based on many MRI findings, whether facet tropism will play a role, whether there is a disc pathology, what should I do? If there is only flaval pathology, what should I do? There is an instability, then will I be able to do fusions? And if I'm able to get this skill and knowledge, the next very important part to understand is what kind of training support I have currently available, which book to refer, what kind of workshops I should attend. Do I have live surgery programs? Do I have cadaveric hands-on program with me? What kind of mannequin training programs available? Is there any book or literature support? And lastly, the most important part which I have understood in my practice, when you are in your early practice, when you have nobody with you, do I have somebody to handhold and teach me, standing behind me and telling me this step is going wrong and this step is not going wrong and this is how you are doing good? And can I have that staff training support? So to answer all those questions, I am Dr. Prasad Patgaonkar, founder of Endospine 360 Academia. We have come up with a training program that is Foundation, Essential and Masters training program. In this training program, we will make sure that you come and observe, have that observership where you get a chance to investigate whether this full endoscopic surgery works or not, because you will be attending a complete busy OPD where you will be understanding the patient's follow-up. There is a 1-year follow-up, 6 months follow-up. You will get a chance to understand what is the pre-op planning going on, how we counsel the patient, which are the patients we really operate, which are the patients we conserve, and what kind of treatment options we offer them. And then you get a chance to be with us in our live surgery. You get a chance to discuss with us the real life surgeries, and then you will have a lecture series, you will have a mannequin training program, you will have a cadaveric training program. Once you get back to your practice, you will get a instrument support, you will get a support from our Endospine 360 faculties, our staff members will come to you, and finally we'll make sure you do your endoscopic spine surgery successfully. And that is the goal of this Endospine 360 Academia. I welcome you all for this wonderful journey of Endospine 360 Academia modules. You start with foundation and you be one of the faculty members. That is our goal. Thank you so much.